menopause has occurred in a lady has taken for more than 1 year without periods. But they also with what we call early menopause, come as early as 35 years.
And welcome to Diagnostic, where we dive into most pressing health topics with leading experts. So today we are honored to have Dr. Karanja with us, who is a renowned consultant obstetrician and gynecologist. He's joining us for an in-depth discussion on female vitality. So, Dr. I'm going to give you an opportunity to introduce yourself to our audience better.
Thank you. My name is Dr. George Emily Karanja. I'm a consultant obstetrician and gynecologist based in Thika, Prime Medical Services. I'm happy to be here.
Welcome so much, Dr. And I have seen you have so much experience over 15 years.
Actually, to be precise, 18 years.
18 years as an OBGYN. So, Dr. let us talk infertility. Yes. It's a topic that usually very much misunderstood. Would you kindly take us through what it means and what are some of the causes?
Okay, when you talk of infertility, usually, of course, infertility is both for male and for female. Because we say that infertility is inability for ladies to conceive or a couple to have a baby. And usually say that for you to meet that criteria, you must have a state for together, having regular and protected sex for a minimum of 1 year. That's why now we say somebody needs to be investigated for infertility. It can be either in a man or it can be in a female. Actually, female around that 5% and 30% combined together. But unfortunately, in this society of ours, most we tend to associate it with ladies, but it also affects a lot of men. That's why we encourage when you have infertility as a couple, it's good to come together so that we can go through and take you through. There are many factors that can cause infertility. As I said, it can be in a lady, it can be in a man. If I say for a man, basically it's when the sperms are either not producing sperms or the sperm count is very low, one million or the other. And the reason for that can be many factors. Can be diseases like diabetes, hypertension, lifestyle issues. It can also be environmental. Like it's known that people who work in very hot areas or hot places, people who work in where they deal with petroleum products and all this, they tend sperm count can go low. So we need to evaluate and of course also cystic, sexually transmitted infections. It can also affect the sperm counts. So for a man, it is good once for me, money we're using because you only do one a sperm count test in the semen to see how the sperms are. And then once we do that, we also can do hormonal tests like testosterone to see if the hormones are okay. And most of the cases, it is something that we, as I say, there is an underlying cause. We can treat that cause, and most people improve. It's something also I didn't mention it that they also obesity, big lot of if you are very obese, sometimes infertility comes because testosterone parts digest hormone, male hormone, the testosterone. So you find that it becomes low. So sometimes we find that it's not because somebody is sick, not their lifestyle, but they are smoking, taking a lot of alcohol, excessive use of alcohol. All these are things that can cause male infertility or sperm count to go low. When you come to the female, it's also there are many factors that can lead to this. One of them is, we'll say, can be due to a problem with the uterus, problem with the tubes, hormones being tubes. Sometimes they get blocked. Why do they get blocked? most of the time it's explosive. There is an infection that comes and it takes long to be treated. Then it interferes with the tubes and they get blocked. And once they get blocked, there is no communication between the egg and the sperm. So you cause infertility. The other issues are diseases like TB. You get and sometimes you get TB and get TB in the uterus, in the ovaries. The other issues that can cause infertility with the uterus is like if you have growth, like fibroids, and they will interfere with the normal way the womb is. And once it interferes, there may be no implantation that the fertilized egg cannot attach. Or it even also can cause tubal blockage, the tube to be blocked because they press on the tube. Or what in simple terms it causes distortion of the uterus. The other issue that also can cause infertility, there are things like people say cysts, ovarian cysts. When they are ovarian cysts, sometimes they produce hormones that affect production of the ovum, the eggs, or even cause. So that is to do with anatomy. Then there is what we call now there are hormonal issues. That is, the hormones are not bad, they are caustic, they are not able to produce. That is, ovulation is not occur. That can lead to infertility. So infertility is a broad, of course, even sickness. If you have a chronic illness, sometimes it also affect your fertility. And also for ladies, also excessive of alcohol, excessive smoking, abuse of drugs, becoming obese over too much weight gain, and also lead to infertility.
So, Dr. Malakapo comes to you seeking for help with infertility. What are some of the investigations that you carry, especially for the ladies, to make a proper diagnosis?
Thank you for that question. When a couple comes with the issue of infertility and we take history, we see that we have infertility. Then we initiate, as I said, we want to isolate what's the cause of the infertility. Then we will start by investigating, and usually say that the common things are hormonal. So we would want to first check through a scan, an ultrasound scan of the pelvic region, just to see how the uterus is, how the ovaries are, whether there are any cysts, whether there are any fibroids, or any other anomaly in that area. Then from there, we would want to do check. There's an X-ray called HND, meaning stereoscervicogram, that checks the inside of the uterus and the tube. That is the one that shows whether the tubes are open. And if now we find that they are blocked, we also would want to know how blocked they are, because they are, sometimes you find it is so blocked, or sometimes it's just partially blocked. If it is not broke and the uterus is fine, then we go ahead and now do more investigation. We go to hormonal examination of the laboratory examination of the hormones, so that we are able to know whether there are hormones causing that problem. Sometimes we find the hormone like prolactin, it becomes high, and find somebody, we had some mothers or ladies are even producing milk and appear to the ovulation. Sometimes you find other. So you want to know whether they are hormonal imbalance, and that can be rectified.
And when you talk of hormonal imbalance, let's talk about MENAC. Does it have anything to do with the onset with fertility? That MENAC that comes in maybe at an early age. Does it have any effect on fertility?
Thank you. So when you say MENAC, it's good to unpack what is MENAC.
Sure.
MENAC is the onset of periods in a girl. On average, it is around 12, 13 years. There are those who we call precocious, comes early, even from 9 years. There are those that delay come to even 16 years. If it comes early, when the periods start coming, that shows the cow is becoming fertile. And if there is a lot of delay, like you find that you're 16 years, somebody still has not gotten the period. That means they have not started ovulating. And of course, it can even interfere with fertility. So yes, it has a role in fertility.
And you have mentioned something about ovulation, which is a key factor when it comes to fertilization. How do you advise your clients on how to track their ovulation?
You see, ovulation is actually the release of egg from the ovary, which occurs when the fertile time, as we say, really fertile date. This depends on varies from a woman to a woman, and this is dictated by their cycle, the menstrual cycle. Menstrual cycle, the ordinary number of menstrual cycle runs from either anywhere between 21 days and 35 days. On average, most people have 38 days. We usually say ovulation occurs 2 weeks, 2 periods. That is constant. What changes between the start of the period and ovulation? So you have a very short cycle, right? That 1 days. It means your ovulation will be 7 days. So 7 days, then 14 days, 21 days. You have a very long period cycle, like that 5 days. It means the ovulation will occur around 21 days. So that is important to know. There are also other factors. There are people who are not regular. You find that this month they are 21, they vary. That can also a challenge to track. These some indicators of somebody ovulating. We say that there is a body change or temperature change. People tend to feel warmer. Uh, you also a new kinds of the produced in the genital area. They become more, we say, more slippery than track. So some people also can experience some pain, one side or the other, sharp pain for 1 2 hours. That is indicator they are ovulating. So there are issues you can be able in a way to track your ovulation, but you have to know the pattern of your periods.
Okay. Does dietary modification help when it comes to fertility?
Of course, diet helps. Diet is a factor because some diets affect hormones. Like as I said, I've told you earlier that there's one obesity. Like obesity affects fertility. So if you are eating a lot of unhealthy foods, it definitely to affect your peace, to affect your health uh, status of that is how bleeding can become, uh, how fertile you are. And also, if you are using, we say, let's say, I'm very unhealthy, like very some things that you are interfere with your steroid. As I said, human is run by hormones. And so anything that you interfere with your take and it interferes with your hormones, then it will interfere with your fertility. So our diet can play a role.
What are some of the treatment modalities that you have for pain pregnancy?
Uh, Treatment modalities depends on the cause of the fertility. As I said, if the infertility is caused by, if we start with the tubes, if the tubes are blocked, and sometimes depending on how blocked they are, we open them, go surgically remove, open them so that we can, be able to conceive. If you have cysts that will interfering with your problem, then you also operate and remove the cyst. If you have fibroids, then also you can also operate and remove the fibroids. If it is hormonal based, then You can use medication to modulate and control the hormone. And if you feel that you are not ovulating, there are also drugs to make somebody ovulate, so they become fertile. So those are some of the interventions. Not forgetting the man.
Sure. For the man, what do you do?
For the man, once we know that as I said, you can have no sperms. If you have no sperm, we need to check and see, is it that the ducts that produce it, ducts are blocked? Is it that you're not producing sperms? So you do also hormonal examination. In the sperms are there, but they are low. The sperm count is very low. We say that minimum need to be 20 million and above, but you can find them very low, or they are not the shape, they are not good, or they are not motile. What we say, they are not active. Sometimes you find the sperms are there, but they are not moving progressively. And also, a sperm has to swim upwards to reach the tubes so that fertilization can occur. So if it is not, they are not motile, they are not mobile, or they are deformed, then it will lead to infertility. Usually, with these cases, at the moment, there are many drugs for correcting these problems. So somebody need not to fear. I find men are they really fear being told they have a problem.
Sure.
So it's good to actually, I would rather be known what is your problem so that it is sorted out. And there are many succeed, and but once you had it, then you remain with that stigma and you're not getting help. Of course, it will be a very frustrating marriage.
You have mentioned fibroids several times.
Yes.
I think it's a good idea that we go through it so that we're able to understand what are some of the causes.
Actually, now that yes, I've mentioned fibroids, I would say for understanding fibroid we call them, most commonly people call them growth in the uterus. Growth, that is, in medical terms, we call them myomas. That is a fibroid. They usually occur. Fibroids, we may want to know, fibroids are common things in our society. We say being black, a black woman is more prone to getting fibroids. Being also around in the family, you find that some families are more prone to get fibroids than others. They are also more commoner in people who stay so long without conceiving or having babies, because we say that fibroids can be made or become more when there is uncharted history levels for a long time. So you find they tend to be more. So people in 30s, they have not had babies, you find they tend to have fibroids. So that is what, in a nutshell, is a fibroid. But the fibroid can also, position can be inside the uterus. It can be in the mass of the uterus, or it can be out, facing out of the uterus. And it depends where it is. How do you know you have fibroids? One, I said, is because you may not be able to want to conceive, you are not conceiving. Two, it causes change of periods. You find that the period become heavy, very heavy, sometimes prolonged, or become you have period many times. Sometimes you can have pain. I'm saying you can get the abdomen becoming, just say somebody that my abdomen pose it, there's a growth. So find that the lower abdomen is becoming big. Sometimes they can also press on the delivery organs, like the kidney, the bladder. You find that some people tend to keep on going to urinate, or when they urinate, they still feel they are not and done with, because it is pressing on them. They can press on the erectors and cause the issues. They can also press on the back, that is the rectum, and you find they have issues of going to the toilet. So those are symptoms that you can, in a way, tell you that this is a fibroids. So how do you treat that? Fibroids, treatment of fibroid depends on whether they have, depends one on with age, two with the objective of why do you want, if you have fibroids and you want to conceive, and also the size of the fibroid. If you want to have fibroids, they are big, you want to conceive, then that's the best option is to remove them surgically so that you have the uterus can be free to conceive. If you are not, you don't want to conceive, or either you are past conceiving, you can either decide to, say, you can either decide to remove the fibroids, you can move the uterus, you can, nowadays you have intervention or ways of, you just block the blood vessels so that you minimize the blood flow to the uterus so they stop growing. You can also use medication, but there are many medication people use, say they are what, but the best medication is injection. While you inject and it lowers the estrogen levels. So making them not to grow, they shake, and then the symptom might improve. So this will depend, but if you are praying so much and all things, and you will not conservative treatment, that is that one of meditation and all, it may not work. So it depends. People, it is individualized.
I was wondering, with the location of the fibroid, does it always affect fertility?
Not always. It's not a must that fibroids affect fertility, because as I said, it can be even low have fibroids, but they are not in the inner side of the uterus. They are those that mean they affect fertilities are those that are facing inside the endometrial side. So they distort that inside of the uterus. That can cause problems. The others might be facing outside of the muscle. They only cause discomfort. What you find that is that you can conceive, but if they are too big, there's a possibility you can miscarry. Or if later on, when the pregnancy becomes bigger, what you see that if there's more space for the big, because they used to have the fibroids are too big, then that can cause a lot of discomfort and even cause the baby to die inside because there's no space. So those are some of the factors to consider.
So, the ones that are outside the uterus, what treatment do you still give medication for the same surgical? What is the best treatment option for those ones?
Yes, you see, as I said, it depends on how they are. They are very big. Even if they are not causing problems, they say they can interfere even cosmetically. Somebody or people, some people you keep on asking, are you pregnant? Because the fibroids are too big. Every hook where like you are trying to be pregnant or different. So that one you see it also affects your image, even if they are not causing problems. And as I say, the other issue is that they will press on the other organs, eventually interfering with the can even cause kidney problems, rectum, bladder. So if they are too big, then
When you say too big, what
big
size?
size, the fibroids can be, people, a fibroid can be measured at centimeters. Okay, yeah, 1-2 centimeters, those are small fibroids. But you find that there are those that are 10 diameter of 10 centimeter, 15 centimeter. That is something that even you as a person will be able to touch and feel. They are big, you can tell I have a broad, but there are those that you don't even feel. It's only a scan that will tell you they are there. So that's what I would call big, those that you are able, even just touching, you can tell.
Because I have heard people suggesting of use of castor oil for the same. Have you heard of that in your clinic?
That's what I say. There are many remedies. People try anything. When you are sick, and people try many things. Castor oil and all this. You see, castor oil, I would say one, it relieves, like if you have fibroid abroad, causing you not to pass through the visual. They will make you, the rectum become okay. So you feel relief. And they may not treat you with the fibroids, but it's a relief.
But for sure, this fibroid is a condition that is affecting so many people. So it is good for our viewers to know that if you are there with fibroids, you're not alone. There are so many people who are seeking for treatment, and it's causing a lot of anxiety.
Yeah, it is. Fibroids nowadays is more than before. One is that the science has improved, so the diagnosis is better. Two, people are tending not to have many children, so they take so long before getting children. So you find, as I say, that you take a long time without having treatment. The tendency of having fibroids come more. You find that areas like this that where they have many children, rarely get so many with fibroids because they say the uterus is busy. But unfortunately, the modern woman now only getting one child, more child, taking maybe the rate practice. Actually, most of the lady do come for start like want to conceive around late 30s, early 40s. The challenge we have with them is the fibroids.
And let us talk family planning. There is the hormonal methods of family planning. Do you think they have a contribution when it comes to fibroid and fertility?
Family planning, the hormonal, yes, we say, okay, family plan depends on family planning. We say there are methods like the hormonal methods, like once you use it for a long time. Sometimes when you want to conceive, you say it's a great fertility. That it is if you stop today, you not conceive tomorrow. It might even take 6 months, 1 year, because it had affected, you are not ovulating often. But there are those family planning, like pills. In fact, even if you stop a day or two, they only stay in a body for 24 hours. Those may not interfere with fertility. But those that are long term, they can interfere, they can delay fertility. They will not stop, they will not make it fertile, but they can delay.
You also mentioned cysts as a cause of infertility. Would you take us through some of the causes of the cyst?
When you say cyst, as it is common, I say it's ovarian, we call it in the ovary. The ovary develops some fluid. A cyst is a fluid in the cyst in the ovary that builds up. It can be very big. It can be one cyst. It can be many, depending on if there are many and they are both. There is a common condition we call it polycystic ovarian syndrome, where we have any cysts producing hormones. That is, the eggs are maturing, but they are not bursting, so they die inside, and where the space they live, they get fluid, and we continue every subsequent ovulation. They get more and more of those cysts. But there are those that we say they are just calm, they are bigger, they enlarge. We classify them as either simple or complex cysts. Simple is that is just a bag of fluid that has not mentioned, but complex is it has inside the cyst there are compartments, and these are likely to produce hormones or interfere with your ability to conceive. So when you say a simple cyst in itself, if I may clarify, is not a bad thing. Because when you're ovulating, where you ovulate, that where the egg comes from. It seals and forms a small fluid, small cyst. So you find sometimes after ovulation, do a scan, you find somebody who has simple cysts. We call them simple cysts, but we call them follicular. And that is after the ovulation. Those are common. Sometimes people come to me and say, I was told I have a cyst. But to try and tell them this is common. Abnormal cyst is a cyst that is one, if it is small and it's painful, then that is not normal. If it is big, like we say up to 4 centimeters, those by most times they are all painful. Those are normal cysts. But beyond a large cyst, beyond 5 centimeters, whereas equal complex, then we need to be checked. And it can interfere with the fertility.
How do you go about the diagnosis?
The diagnosis, the most surest way of diagnosis nowadays is a pelvis scan ultrasound. Those nowadays they are available. Of course, clinically, you can tell if it is a big swelling. You can tell there is a swelling, but to confirm, you need to do a scan, a pelvic scan. That's when it can confirm to you whether what kind of cyst it is.
When it comes to treatment, do you have a treatment for that?
Treatment depends on. Sometimes they say it's a simple cyst, small, not painful. Sometimes you leave them or you just leave them and observe. And also depends on the age. If it's a young person who is in productive age and have those simple cysts, then you sometimes observe. If they are big, if they are big like 5 centimeters, you can give, you observe, you can sometimes, depending on how they are simple, you can give something like pills just to say stop the ovulation and all this. But if they are big, like 10 centimeters and above, whether they are painful or not, they may have to remove them. If the cyst is somebody 45 and above that is already going to menopause and have cysts, then you may have to do more investigation because this might not be ordinary cyst, like even ovarian cancer coming in. So you need to think more than that this is reproductive related. This is now more maybe a malignancy coming in. So
Good to have an investigation.
you need to have the relevant investigations.
Okay. Let us go to endometriosis, which is a major concern for very many young people. When it comes to diagnosis, it is quite challenging. Can you take us through that?
Yes, thank you for that question. So when you say endometriosis, it's good to define what is endometriosis so that somebody can understand what you mean. Endometriosis is a condition that occurs, it is in a uterus. We say uterus has 3 layers. It has an inside layer, we call it endometrial layer. It has a muscle, it has the other lining outside. If this inner layer, the endometrial layer, is where they respond to hormones. And so it changes. It's the one that changes depending on the hormones, and it peels off during period. To have a period. If one is on the other, that these cells of the endometrial cells are found out of the uterus. Sometimes outside the uterus, they either on the ovaries, the intestines, or the rectum. Then that is what we call endometriosis. And the endometriosis, these cells, when they are there, they also respond to hormones. So you find that they cause when they cause pain because they are sweating and all this, that there is nothing happening. So they will cause pain and that is inflammation, especially toward during periods. And that's when you find people keep on saying they have a lot of pain during periods. It's common in young people. It's more common in young age. It's a diagnosis that is not easy to make because endometrial tissue is like any other tissue. So even if you check, you may not even do a scan, may not say this is, unless a swelling that is big, may not find any problem, but it is a diagnosis of suspicion. You have to say, if you are having periods and become when they are very painful, that's not normal. So when you in and you keep on recurring, then you have to suspect, could this be issue of endometriosis? So once you suspect, and nowadays how you confirm, unfortunately, is by by seeing laparoscopically. You go in and check and see these are the endometrial tissue. Of course, nowadays, if you see that, we are able to sometimes remove them, remove, try to remove, you see the tissue, you remove them. So, but it's a difficult diagnosis. Because, like I said, it's not very clear to many unless it's obvious, like extreme pain. Of course, there are also endometriosis, as I said, this tissue can also, most of the time, they tend to be around around the pelvic region, the lower side. But they can also spread even to lungs, to other areas. They cause climates. We explain to other organs, they also cause problems. And so you are like finding somebody during periods, you having chest pains, okay, blood, they are coming out. So those are things that sometimes can cause havoc.
There are those that we go to the hospital and are told, for now, it's just a little that we can remove surgically. How effective is that?
We call it endometrioma, that is a swelling, which is one, it is quite effective because you are able to, with the technology that is available now, we are more, you are visualizing that swelling and you can be able to remove. Of course, it reduces the pain and all this, and you do your best, although sometimes you may not move everything. But the way it is, I have seen a lot of relief for ladies when they are removed, they have endometriosis and the whole endometrioma are removed.
So, Dr. when it comes to management of infertility, kindly take us through the IVF treatment modality.
Okay, thank you. IVF, as simply put, we call it in vitro fertilization. That is, or people call it test tube babies. It's a technology that is aimed at helping people who are not able to they have eggs, they have sperm, but for one reason or the other, like they have blocked tubes, so it cannot the fertilization cannot take place naturally. So what happens is that you take harvest eggs from the lady. Usually it's a simple cycle procedure. You harvest the egg, then you take the sperm, you go to the lab, you have make them fertilization occur, then you implant or take you give drugs so that the lady is ready for what we call implantation, ready to take the pregnancy. Then you insert the eggs into the womb. Usually you do it 3 or so eggs, you pick 3 or so eggs so that your chances, sometimes the one egg can pick, two can pick, three. So once they do that, then the natural process continues. And pregnancy, once the implantation occurs, they carry their pregnancy to term. So the main aim of IVF is just to remove. It's meant for people who are especially reproductive or that they are not able to. It's a technology that's there. It's at the moment about 8 facilities that are doing that. The only hindrance is about the cost. It's a bit expensive. Ranges from 400 to 500,000. So that is what is hindering women to go for IVF. But If you have means, it is a genital pregnancy because the only process is that it is being done outside outside the body, but everything else
Just continue.
continues.
The success rate?
The success rate, say 23%, 25% in the best centers. This is well, it sometimes depend, but around 25%, 20-25%.
What coping strategies do you have in place for people with estrogen infertility?
Coping well, the coping is actually they need to understand what is the problem they have. Two, whether there is remedy for that problem. Three, what are the options available? Because if it's something that is rectifiable, like as I say, if you require surgical intervention, you require IVF. There are those who can, with infertility, they cannot yet carry a pregnancy. They may benefit from surrogacy. That is, surrogacy is having the egg, the sperm, and you get somebody to carry for a pregnancy for you. Also, traditionally, the man had the issue that might be a sperm donation for the lady. There are also issues of adoption. You are not able, the couple is not able fully to get babies. They have an option. And that's now allowed that you can sign papers and request for adoption and you'll be allowed. Now, before adoption, people could adopt children in-house, but nowadays you have to prove there is a reason why you are not, you want to adopt. Okay. So those are some of I will say coping mechanisms. Because of course the support, the psychological, it affects people a lot. So they need psychological support, they need support from the family, not the family members, keep on asking why not, especially that bad issue. Because what happens is that if already has been a marriage for some time and not conceiving, you don't go telling everyone that you have a problem. But the relatives keep on asking, why are you not having a baby? So sometimes you find it's something that make even ladies isolate themselves or even go to depression. But to me, I always say it's because it's not you who it's not your wish. You should not be afraid. You should, by speaking it out, when that is part of hope, and you will stop, people will stop judging you.
So that's why I think it's so fair to touch on. If you're talking about fertility, let us talk menopause as well. I feel it's a topic that people are not touching, and it is quite sensitive. When should we expect menopause?
Thank you for that. I would start by defining what is menopause. Because menopause it's a very common word, but not well understood by many people. Menopause occurs in ladies. It is a time the periods or disease they are getting their monthly periods. We say that menopause has occurred in a lady who is middle age, has taken for more than 1 year without periods, and has symptoms and signs of menopause. That's when we say menopause has occurred. In Kenya, the average age of menopause is 48, 49 years. But menopause can occur from 45 years. There are people who, so as early as 45 years, can go, there are those who will go 55 years, they have not gotten menopause. But they also, what we call early menopause. Early menopause can come as early as 35 years. And most of this is, indeed, there is an issue, but commonly menopause occurs from 45 and above years. So our lady with 45 and above have not gotten periods for a whole year, is not on any family planning or anything, then that's when they define as menopause. There are signs and symptoms of menopause. Before menopause occurs, you find that most ladies get irregular, the pattern of periods start changing. Either they would want to sleep 1 month, 2 months, or they come and it was heavy, sometimes it's light. So the pattern tend to change around 1 to 2 years of menopause. At the same time, around that time, you find that there are signs, symptoms, like somebody, you feel that they start sweating, what we call hot flashes. You find all of a sudden you just feel sweaty, like 5 3 minutes, you sweat and then stop. Then also mood swings. You find that the mood changes. That some people become more irritable. They You find that skin. Some people, especially, they feel dry in the genital area. Although this is more common uh, for hot flashes are more common in white. Dryness is more common. Dryness is more common in white. Feeling very dry. That even sometimes people start having pain for sex, or they just feel like very weak. They are not happy about themselves. And say sometimes they come and say, I'm sick. So those are symptoms of menopause. Of course, what brings about menopause? We say a woman is born with her eggs in the ovary, the two ovaries. On average, it's around 200 to 400,000 eggs. And every month you keep on, losing the eggs. You keep on. So eventually they get depleted, or even those that are our age, those that are even there, they are too weak and they cannot even produce. Now they are not viable. And the ovaries stop almost not able to produce normal hormones. That's when now that change, especially estrogen, that's when we say the menopause sets in. Uh, Menopause is important because we say that once it is setting, now you say ladies almost start very like men. They are now more like to do it. They are not, the estrogen levels have gone down, and they not some don't feel like ladies. It is usually a difficult time of life for many ladies because there are a lot of changes. As I say, there is a mood swings, feeling sickling, you're not yourself, and this is not well managed. They tend to really cause problems in the families because the people who are not understanding what is going to do, or all of a sudden you are shouting to them, you are shouting to people, you are doing this, it can cause problems. So it is good to understand. Medically, menopause also can cause an issue because I say it can be so bad that you are not even able to perform. Because some people even concentration goes low. They don't concentrate, they're sweating a lot. Sometimes you find that after menopause, because of the low estrogen levels, the bones become weak, and they can even tend to have fractures. So those are the challenges. Of course, people might ask, is there a remedy for menopause? Menopause is, as I say, a natural process. It tends to, after 2 3 years after menopause, people tend to stabilize and go back to normal. But before they stabilize, that change, sudden change of estrogen levels. What we encourage them is that there are cracks. One, there are food stuffs. Anything that is rich in estrogen will improve your well-being. We say, for example, soya. Soya is very rich in estrogen. So you find people as a communities, they encourage people to take a lot of soya. And actually, medicine that are there, most of them extract of soya, so that it just improve your estrogen. It is so bad That's when they give hormone replacement therapy. Like as I said, you are not horny, you are not really, then over some, you can give hormone replacement for a period of time, not for a long time, because initially going to exist 6 months, because can also cause problems. But those are remedies that are there for it to take. And of course, accepting the other aspect is knowing what is happening to you. So you also accept that this has happened. It was it comes when somebody is not ready. Like for example, they wanted to have babies, they have not had babies, they are not, a lot of crisis. But basically, it's something that every woman should understand and know that it will come.
And as well as other people should support them,
Yes,
especially the spouses
yes,
and the children as well.
yes. That's what I say because midlife crisis goes for women, so that they come, they don't need the states in a way.
Sure. And the worst part of it is that we don't even know when it's going to set in.
Yes. Although as I said, it has a health, you can be able to, but there is a way of confirming whether, if you are not sure, you can do hormonal tests. Estrogen, progesterone, you can tell the ratios. Then they will tell you whether you're having menopause setting.
And I tell you, our society is changing so much, and people are prioritizing uh, growing in life, and opting to have children later on. Do we have egg harvesting in Kenya? Or
That's a new technology that's coming in, egg harvesting, so that you can preserve your fertility.
yes,
It's a good thing that happens in the developed countries. In Kenya, we have had, it's coming up, but what has hindered these processes is code of rules. Uh, there are no laws that to guide about harvesting, surrogacy, all those relating to fertility and how to handle such issues. But I think this law has been a parliament. I'm not sure unless I check whether it is passed, because it's been going through what, because it is if I keep my eggs, housing where you not use it to somebody else, or you not how long, they need to be defined. These rules need to be defined properly so that they are not abused. Yes, but it is a good thing. It happens. Like I know in US, people, they are going for military uh, missions. They harvest their eggs or sperms and keep them for them, just in case something happens. But here is something that is a technology that is coming in. But I cannot pinpoint tell you today that this facility has is preserving eggs.
so Daktari, thank you so much for the information. We have really covered into a bit of topics that we had planned for today. And I think the reason why we have captured those many topics is because we understand your busy schedule. And thank you so much for giving us so much information just for free. We didn't pay the consultation fee. I know at your clinic there has to be a consultation fee. Where can they find you?
Thank you, Pauline. Yeah, I'm most happy. It's my joy always to inform and to give knowledge. When you are given knowledge for free, it's also good to pass it for free.
Sure.
And what we have covered is just about, not just touched on people, so that small issues, so that they can understand what is happening. I hope somebody has been helped by our discussion today. I am usually located in Vika Arcade, that floor, called Biomedical Services. That's my office. You can always call me, but sometimes they don't get me. They can always SMS me. I respond to my SMSs and calls where possible.
So Daktari, in your consultation clinic, what are some of the services that you offer?
So we offer all services related with gynecology, that is consultations, family planning, minor surgeries, uh, reviews, antenatal care, medical, investigations or infertility investigations, and of course, when surgery is required, uh, I consult and work with all the major hospitals in Thika, Nairobi, and be able to admit my patients accordingly where they now follow them up. I'm always available. I may, if I'm not available, you can always reach out to me through my number, which is 0722 1971. This number is, I always answer my calls when I am able. If I'm not, you can always SMS me or WhatsApp me. I will always answer you. And it is, I love interacting with the patients and clients. My office is located in Quick Arcade, and floor, room 304, all Prime Medical Services Limited. Thank you.
Thank you so much. And in case we want to reach out, I feel there is a lot of information that we need to squeeze out of you. There are so many topics in regards to gynecology that we can cover. So thank you so much to my viewers. We have come to the end of our episodes today, and I want to say that whatever it is that you're going through, whatever condition that you're having, it is good to always open up, seek treatment early because you're not really sure of what you're dealing with. You are not alone. I have been your host, Pauline Ngure. Until next time, see you then.